So erectile dysfunction is a very common problem. I think it's underdiagnosed and undertreated in America. Approximately 1/3 of men in the middle age experience erectile dysfunction on a fairly regular basis. So the most common cause is cardiovascular disease. The same things that cause heart attacks and strokes can cause erectile dysfunction. And in fact, many men present with erectile dysfunction before they have their cardiovascular event. So it's important to see a doctor as soon as you're experiencing these problems. So generally the first line of treatment are oral medications. There are prescription medications that have been around for over 10 years now that are well proven to be effective. And generally your primary doctors will be prescribing those medications for you. But beyond that, if you're not having good results or you're not being provided satisfaction with those medications, then usually seeing a urologist like me who can provide further treatments beyond that is recommended. There are some treatments that I use prior to recommending surgery. Those involve injection therapy. In addition, there's also a suppository that goes into the urethra, the tube you pee through, and that can stimulate an erection. If you aren't satisfied with those treatments, then I oftentimes will discuss the surgical therapies that I offer. The main surgical therapy is a penile prosthesis implantation. There are two types of prostheses. There's a two-piece or malleable prosthesis that just has two bars implanted into the penis that you can bend up or down. And then there's a three-piece or inflatable prosthesis that I commonly will place that has two cylinders in the penis, a pump in the scrotum, and a reservoir balloon in your abdomen. You cannot see any of these devices and no one would know that they're in you. However, they function very well to provide a very natural appearing erection with normal sensation and normal ejaculatory function. The operation takes about an hour and a half. It can be done on an outpatient basis. I often keep the patients overnight for observation. You should expect approximately 2 weeks of being fairly sore, and you should be able to return to sexual intercourse by about 4 weeks. So generally, I'm teaching the device to be cycled, inflated and deflated in about 4 weeks, and at that point patients are usually cleared for intercourse. So the advantage of a prosthesis is that it's portable, it always is with you. You don't have to refill anything, you don't have to remember to travel with anything, and the spontaneity of sex is, again, around because you can always initiate an erection without having to worry about it. Well, the advantage of seeing someone like me in our clinic is that we provide the full spectrum of treatment and diagnosis. We'll see you from the beginning when you're just starting to try medications, educate you through the injectable or implantable options, and then carry you through surgery. You'll have the same team of doctors and nurses. You'll have the same team in the hospital, and we'll always be around to support you, and we're very available to you.